Gastrointestinal emergencies encompass a wide range of conditions that can quickly become life-threatening if not addressed promptly. These emergencies may present with symptoms such as severe abdominal pain, vomiting, or gastrointestinal bleeding. Rapid diagnosis is crucial, as delays in identifying the underlying cause can lead to serious complications, including infection, organ failure, or even death. Effective management often requires a coordinated approach involving clinical assessment, diagnostic testing, and timely intervention. Recognizing the urgency of these situations is essential for improving patient outcomes. Acute pancreatitis is a sudden inflammation of the pancreas, most commonly triggered by gallstones or excessive alcohol consumption. Patients typically experience intense pain in the upper abdomen, which often radiates to the back. This condition is also characterized by significantly elevated levels of the enzyme lipase in the blood. Recognizing these symptoms and laboratory findings is crucial for timely diagnosis and management. Cholecystitis typically presents with pain in the right upper quadrant of the abdomen, often accompanied by fever. A key clinical feature is a positive Murphy sign, where tenderness increases during inhalation when pressure is applied to the area. This combination of symptoms helps differentiate cholecystitis from other causes of abdominal emergencies. Recognizing these signs is crucial for timely diagnosis and management. Appendicitis usually starts with pain around the belly button, known as periumbilical pain. As the condition progresses, this discomfort shifts to the lower right side of the abdomen. This change in pain location is a classic sign that helps in diagnosing appendicitis. Because the appendix can become inflamed and potentially rupture, surgical removal is often necessary to prevent complications. Intestinal obstruction is characterized by symptoms such as abdominal distension, vomiting, and a lack of bowel movements. These signs indicate that the normal flow of intestinal contents has been disrupted. Prompt evaluation is essential, as delays can increase the risk of serious complications, including compromised blood flow to the bowel. Early recognition and intervention are crucial for improving patient outcomes and preventing further deterioration. A perforated peptic ulcer is a serious medical condition that can cause an acute abdomen, presenting with sudden and severe abdominal pain. This occurs when an ulcer creates a hole in the wall of the stomach or duodenum, allowing air and digestive contents to escape into the abdominal cavity. One of the key diagnostic signs is the presence of free air under the diaphragm, which can be clearly seen on imaging studies such as an upright chest or abdominal X-ray. Prompt recognition and treatment are crucial to prevent further complications and improve patient outcomes. Electrolyte disorders are common medical conditions that can significantly impact a person's health. Imbalances in key electrolytes such as sodium, potassium, and calcium often lead to serious clinical consequences. Abnormal sodium levels can cause neurological symptoms, while disturbances in potassium may affect heart rhythm and muscle function. Calcium imbalances can influence bone health, nerve transmission, and cardiac activity. Recognizing and managing these disorders promptly is essential to prevent complications and ensure optimal patient outcomes. Hyponatremia occurs when the sodium level in the blood becomes abnormally low. This condition can be caused by factors such as the syndrome of inappropriate antidiuretic hormone secretion, the use of diuretics, or drinking excessive amounts of water. When sodium levels drop significantly, the brain is particularly vulnerable, leading to symptoms like confusion, seizures, or even coma. Prompt recognition and management are essential to prevent serious complications. Hypernatremia occurs when there is an excess of sodium in the blood, most often resulting from a loss of water, rather than an increase in sodium intake. This condition commonly presents with neurological symptoms such as confusion, irritability, or even seizures, as the brain is particularly sensitive to changes in sodium levels. Treatment involves gradual correction of the sodium imbalance, as rapid shifts can lead to serious complications like cerebral edema. Therefore, careful monitoring and controlled rehydration are essential in managing hypernatremia safely. Hypokalemia, or low potassium levels, can cause muscle weakness and increase the risk of abnormal heart rhythms. One classic sign on an electrocardiogram is the presence of U waves. In contrast, hyperkalemia, or elevated potassium levels, is often identified by tall, peaked T waves on the ECG. This condition poses a significant danger, as it can quickly lead to life-threatening arrhythmias if not promptly addressed. Hypocalcemia, or low calcium levels in the blood, often leads to symptoms such as tetany, which is characterized by involuntary muscle contractions. Two classic physical findings are the Kvostek sign, where tapping the facial nerve causes twitching, and the Trousseau sign, which involves hand spasms when a blood pressure cuff is inflated. In contrast, hypercalcemia, or elevated calcium levels, is commonly linked to kidney stones, bone pain, abdominal discomfort, and a range of psychiatric symptoms, including confusion and mood changes. Recognizing these distinct clinical features is crucial for accurate diagnosis and management. Anesthesia and critical care environments demand swift and accurate responses to emergencies. Rapid recognition of complications such as airway obstruction, cardiac arrest, or severe allergic reactions can be life-saving. Early intervention, including securing the airway, administering appropriate medications, and initiating resuscitation protocols, is essential. Teamwork and clear communication play vital roles in managing these high-stakes situations effectively. Continuous training and preparedness help ensure the best possible outcomes for patients facing critical events. Malignant hyperthermia is a rare but serious reaction that can occur during or after exposure to specific anesthetic agents. It is characterized by rapid onset of muscle rigidity, a dangerously high body temperature, and significantly elevated levels of creatine kinase in the blood. This condition requires immediate recognition and intervention to prevent severe complications or death. The primary treatment is administration of dantrolene, a medication that helps relax muscles and reduce the body's temperature. Delirium tremens is a severe complication that can occur during alcohol withdrawal. It is characterized by confusion, agitation, and instability of the body's autonomic functions, such as heart rate and blood pressure. This condition is considered a medical emergency and requires prompt treatment. Benzodiazepines are the primary medications used to manage delirium tremens, helping to reduce symptoms and prevent further complications. Sepsis is a serious medical condition that occurs when the body's response to infection becomes unbalanced, leading to life-threatening organ dysfunction. This dysregulated response can cause widespread inflammation and damage to vital organs. Early recognition and prompt treatment are critical to improving outcomes. Administering antibiotics quickly and providing fluid resuscitation are essential steps in managing sepsis effectively. Ophthalmology emergencies encompass a range of conditions that require immediate attention to prevent permanent vision loss. Some of the most critical vision-threatening emergencies include retinal detachment, acute angle closure glaucoma, central retinal artery occlusion, and chemical injuries to the eye. Recognizing the signs and symptoms of these conditions is essential for timely intervention. Early diagnosis and prompt treatment can make a significant difference in preserving a patient's sight. Understanding these emergencies helps ensure that urgent care is provided when it matters most. Glaucoma is a condition characterized by increased pressure within the eye, known as intraocular pressure. This elevated pressure can damage the optic nerve, which is essential for vision. In acute angle closure glaucoma, symptoms develop suddenly and may include severe eye pain, rapid loss of vision, and seeing halos around lights. Prompt recognition and treatment are crucial to prevent permanent vision loss. Cataracts lead to a gradual and painless decline in vision, often making daily tasks more challenging over time. In contrast, diabetic retinopathy develops as a result of prolonged high blood sugar levels, which damage the small blood vessels in the retina. This condition is marked by the formation of microaneurysms, retinal hemorrhages, and abnormal new blood vessel growth, known as neovascularization. Both conditions can significantly impact vision, but their causes and progression differ considerably. Retinal detachment is a serious eye condition that often begins with warning signs such as sudden flashes of light, the appearance of floaters, or the sensation that a curtain is descending over part of your visual field. These symptoms indicate that the retina may be pulling away from its normal position at the back of the eye. If left untreated, retinal detachment can lead to permanent vision loss. Because of the urgency, anyone experiencing these symptoms should seek immediate evaluation by an ophthalmologist. Ear, nose, and throat emergencies encompass a range of acute conditions that require prompt recognition and management. Common presentations include severe sore throat, sudden hearing loss, nosebleeds, and airway obstruction. Each emergency has distinguishing features. For example, epiglottitis often presents with drooling and difficulty breathing, while peritonsillar abscess is characterized by a muffled voice and unilateral throat pain. Identifying these key symptoms is essential for timely intervention and preventing serious complications. Otitis media frequently affects children and is typically characterized by ear pain and fever. This condition involves inflammation of the middle ear, often following a respiratory infection. In contrast, otitis externa is distinguished by pain that worsens when the outer ear, or pinna, is manipulated. Recognizing these differences is important for accurate diagnosis and appropriate treatment. Nosebleeds, or epistaxis, most frequently begin in an area called the Kieselbach plexus, which is located in the front part of the nasal septum. Sinusitis, on the other hand, is typically marked by facial pain and a feeling of nasal congestion. In contrast, tonsillitis usually presents with a sore throat, fever, and visibly enlarged tonsils. Recognizing these distinct patterns of symptoms can help in identifying the underlying cause of a patient's discomfort. Emergency medicine is dedicated to the rapid assessment and treatment of patients facing acute illnesses or injuries. Trauma care, a critical component, focuses on managing life-threatening conditions such as severe bleeding, airway obstruction, and shock. Immediate interventions often include securing the airway, controlling hemorrhage, and stabilizing vital signs. The goal is to quickly identify and address the most serious threats to life, ensuring patients receive the urgent care they need to improve their chances of survival. Tension pneumothorax is a critical condition characterized by low blood pressure, a shift of the trachea away from the affected side, and the absence of breath sounds on one side of the chest. These signs indicate that air is trapped in the pleural space, compressing the lungs and major blood vessels. Without prompt intervention, the patient's condition can deteriorate rapidly. Immediate needle decompression is necessary to relieve the pressure and restore normal breathing and circulation. Hemothorax is a condition where blood collects in the pleural space, the area between the lungs and the chest wall. This accumulation can impair breathing and reduce oxygen exchange. In contrast, cardiac tamponade is characterized by the presence of Beck's triad, low blood pressure, muffled heart sounds, and distended neck veins. These signs indicate that fluid is compressing the heart, preventing it from pumping effectively. Both conditions are medical emergencies that require prompt recognition and intervention. Shock is a critical condition that demands swift recognition and immediate action. Without prompt intervention, shock can quickly progress to organ failure, significantly increasing the risk of serious complications or death. In emergency settings, early identification and management are essential to improve patient outcomes. Timely treatment can make the difference between recovery and irreversible damage.